everybody. Can you hear me despite my British accent? I was trying to do my Brooklyn twang then, but it's not very convincing. Great to be here. I'm going to talk a little bit about innovation from around the world and a few stories that illustrate some of the interesting things that we're seeing at Aging 2.0. The story starts in New York City 5 years ago with a conversation that I was having with my doctor. Around 5 years ago, a very wealthy man from Texas was actually in the process of receiving a very grim diagnosis. Unfortunately, he was diagnosed with a rare progressive supranuclear palsy, a frontotemporal dementia. And he became one of the 5 million people in this country who is living with dementia. And unlike many of those, in fact, most of those other people in this country, he was very, very wealthy, and he devoted a good amount of his money to doing research to try and find a cure for this very unique disease. That's me in the corner at the back. I was a small part of this project team for a couple of years. I got very inspired by one conversation that the family had when they were saying, look, we have just become caregivers. We don't really know what that means, but there's not very many products and services out there. Where is the technology? Where's the innovation that can help us do a better job of caring for our father? And I heard that and I was quite struck. My background, I'm from the UK, but I've spent a lot of the time abroad. I was in Finland, I was working in the mobile business. I came to the US. I was all about technology, startups, the 2.0 world, which is reinventing all sorts of industries. I now live in Silicon Valley, which is the center of the beating heart of technology innovation. But frankly, there was very little innovation focused on improving the lives of older people, improving the lives of people with dementia and their families and their caregivers. So this started this idea of Aging 2.0, this idea of let's find the fantastic ideas, the innovators from around the world, and connect the technologists, the designers, the next generation brilliant insights with the aging and senior care, and the people that we've been hearing already today facing so many difficulties, so many challenges. Let's put these two worlds together. So the science fiction author William Gibson put it rather nicely when he said, the future is here, it's just unevenly distributed. And a couple of these stories are going to be describing some of what I think is the future emerging that we can start to see here in this country shortly too. The first step is across the pond in the Netherlands, and we meet Corrie Visser. Corrie is in her 80s, and Corrie was just diagnosed with severe dementia. Her husband Theo and their 2 children really couldn't look after her anymore, and so with regret had to put her in a facility. And it turned out that there was this place, Hugevik, which was in Weesp in the Netherlands, which is, you might have seen in the news, being called the Dementia Village. It's a fantastic innovation where they have this whole village that's designed for people with dementia. They have the streets are completely normal. They look like a regular village. There's people walking up and down the streets who are actual nurses and experts, but they don't have their nurse outfits on. They just have the sort of regular kit. So it feels like just a regular village. There's just one entrance and exit from this village, and so there's a security piece in play, but it's very subtle. It's very well designed. Corrie's apartment is actually, and all the apartments in the village are designed for the decade that makes her feel most comfortable. So in this case, the 1950s, keeps her at ease and allows her to feel connected. The cost, it's not cheap. It's something like about 8,000 euros a month, but the government is subsidizing this well over half price, and so Theo can afford to pay for it, and the family can afford to pay for it, and he goes and visits them every day, Corrie every day. The Netherlands and the Belgium is a real hotbed of innovation. We've been seeing a lot of the people that we speak to over there are just coming up with fantastic ideas. It's really connecting the social and the healthcare side of things. There's a place called the Living Lab where they have a number of people, a number of residents connected in a community, and then they bring in startups and new technologists, and they have hundreds of new companies and ideas connecting with real people so they can test and get feedback from the new ideas. So we'll jump on our plane and we head over to Japan. Inevitably, any talk about the future of innovation, technology, and aging is going to involve Japan. And here, Satsuko Yatsuzaka is an 85-year-old lady. She moved into a community near Fukushima, a nursing home, after the tsunami in 2011. And she was very anxious, and she has been testing out these new robot seals. Has anybody seen these things? The Paro seal, you might have come across them. It's a wonderful idea. It's a small robot seal. It looks very cute. It has the ability to talk, to connect, to have a communication, to respond. And it's been doing really well. She has been working in this, she's been living in this nursing home, and there's one called Peace and the one called Love. And it really does do a good job of calming her down and keeping her in a better condition. In Tokyo, they have a lot of innovations around technology and innovation. Up the smaller picture on the top is a exoskeleton made by a company called Cyberdyne, where they have people who are in communities can lift heavy objects. In this case, there's two nurse aides are lifting a person, but it's also being used in the factory floor, where older workers can stay active and use this exoskeleton to lift heavy objects. Panasonic is testing a new technology which combines a bed with a wheelchair to make it much easier to get people in and out. And there's even a robo-bear, which is part bear, part robot, which is used to help lift heavy weights. The Japanese are really quite inventive and coming up with all sorts of new technologies. Lower tech innovation here from my country in the UK. Ajit Singh, he's in his 80s. He lives in Redditch in the UK. He was feeling very lonely. He was living independently, but didn't really have any friends. And he was happily part of this program called Reconnections. And this is a program which is supported by Age UK, and they provide a personalized concierge to go in and to chat with Ajit and ask him about his interests and what he cares about, and creates a plan, a socialization plan to connect him back into the community. They connected him with a group called The Shed, which is based on the very British concept of sheds, where men in sheds go and they sort of tinker with things and they get together and they talk about things that men in sheds talk about. And he has been extremely happy making things like this lamp with his hand. So he's not only connected socially, but he's also productive and making things again. This kind of engagement is obviously helping him keep active and out of long-term care. We zoom down to Australia. We have a chap called Joe. So Joe Corey is 63. He's been out of work for over 3 years before he got this role. He is one of the 65% of people in Australia who are over 55 who don't have a job. Accor Hotels, which is one of the big hotel chains, said, look, this is a real problem. They, as a hotel chain, only had 8% of their workforce over 55 themselves. So they said, let's do something about it. Let's create a new program to improve the lives, to improve our sort of working experience for older people. And so they had this global, this new program for the experienced workers. It's a 5-day program that trains older people. And Joe went through this program, got a great job, and he's now working in the Pullman Hotel, and has been 3 of the last 7 months since this story came out has been elected the Employee of the Month. Really capturing value that we as a society and a community don't recognize, especially when it comes to older workers. Jumping over to South Africa. In South Africa, there's a wonderful organization called AgeWell Global, and there's a lady, Mandisa Zala, who is 69 years old, and she's been working with them. So Age Well Global has this idea where they're connecting older people who are looking for meaning, looking for work, looking to contribute back to the society, and they help other older people stay independent and connected in the community. So she goes out, she has the two tasks. One is to be socially connected with other people, to go and meet other people and help them to stay independent, to talk them through their lives. But also she has a mobile phone, she has a smartphone. So she ends up being educated and connected and is able to help connect them with their medications and do basic telecare and telehealth. So coming back to the US, many of these ideas are similar things already in the US, but the conversation that we're having is just so interesting to see. This is a global phenomenon. The aging of our world is something that is not happening just in the US. In fact, in Europe and Asia, it's more pronounced than it is here. So the first sort of takeaway here is let's not reinvent the wheel. Let's just let's steal ideas that are good ideas from wherever they happen to be. In fact, another of our Aging 2 members in Southern California, Front Porch, has just finished a 6-month program testing out these Paro robot seals. And they have found that they did it with 160 people over 7 communities, and they found an 80 to 90% reduction in pacing, in anxiety, and in general stress levels for people with, and wandering for people with dementia. So these ideas are working, and they're working already now in the US. The context counts. Each one is different. We've been seeing in Japan lots of innovations in robots, but frankly, the Japanese situation is quite different because they have a very limited numbers of immigration, and then we have a much more, there's much more sort of tech forwardness. They like technology, and they like these ideas, for example, of robots replacing humans. So it's not going to work for every environment. The third point I'd make is that technology that we're seeing, the really good stuff, is complementing. It's not competing. There's a lot of the stories in the press and the media about how we are going to be destroying, or artificial intelligence, the robots are going to be destroying our jobs, and I'm sure that's going to happen to an extent. But some of the most inspiring examples are here where technology can be used to support and enhance people's lives. So for example, the older caregiver who can stay working and doing the job she loves with an exoskeleton suit to help take some of the strain. And the final point is that innovation here, there's a lot of technology, but it's perhaps some of the more interesting stuff is not just the technology, but about the usability and the business model. So usability, we have older adults in our program, we call them the chief elder executives, and we have startups that are really excited to be sitting down and connecting and chatting with older people and together creating products. And this is something that we call sort of designing with, not for. And it's really important to think through design experience from the perspective of the person who's using it. And a lot of the time, us sort of technologists and the 25-year-old kids who want to do interesting things don't necessarily know how to reach out and speak to and connect with older people. And so I think in this room there's many people who would be wonderful discussion partners for some of the many thousands of entrepreneurs around the world who are looking to connect and have those conversations and work out how to do a better job of long-term care. And the final point, this is the business model. I think we're seeing some big changes in the US, but also in the UK, the program that was funded, the Social Connections program, was funded by the government on a pay-for-performance basis. So the government wasn't going to pay anything unless those projects work. And we're seeing a lot of innovation like that in business models and usability to support some new technology. It's an exciting time to be part of this discussion, and thanks very much for sharing the conversation and the journey with me today.